understand this
Welcome
is
to
a very
Be More News.
important activity that you need to be involved in, okay? My message for you is very simple, get tested, get treated, because it is a disease that's in our community and one that we don't necessarily pay attention to as much as we should. There are about over 1 million people who are living with HIV. 225,000 don't even know they have it. You'll be passing disease to a loved one and not even know it. So the idea is to get here, get tested, and like I said, get treated. It's something that we all need to be aware of, and I want you to be glad that you're here. You can pass the word to your friends and family so they know this is something they need to address, And if you do get sick, you got Total Health Care right here. We'll be glad to treat you, okay? Now I guess Rick.
Thank you, Dennis. Okay. Hey, hello, everyone. Hey. We're glad to be here. We love Total Health Care. And as Dennis said, my name's Rick Reeves. I'm the president of United Healthcare Community Plan. And we serve Maryland's health choice and primary adult care programs. And we are really honored today to join Total Health Care in their support of this important event. Total Health Care and their staff are dedicated to providing coordinated healthcare services for patients who suffer from HIV/AIDS. They're also community leaders in providing preventive services and awareness to slow the spread of HIV and improving the overall health of those who live with the disease. Their efforts, along with those of other community health centers across the country, have resulted in reductions in the transmission of the disease as well as extending the life expectancy of those who live with it. The first cases that were reported, the first cases of the disease that would later be known as HIV/AIDS, were first reported in June of 1981, 30 years ago. Since then, 1.7 million people in the U.S. are estimated to have been infected by HIV, including nearly 600,000 who have already died, and 1.1 million folks who are estimated living with the disease today. I had a friend of a dear friend of my sister's was a victim of HIV/AIDS. She was one of those folks that Dennis mentioned who wasn't aware that she had it. It was passed to her by her husband. It's a terrible, terrible disease. We lost her. She was an absolutely beautiful girl. Every 9.5 minutes, someone in this country is diagnosed with HIV/AIDS. This epidemic spans the nation. And obviously it's been reported in all 50 states. We applaud the work that's being done today by Total Health Care, and I think Total embraces the vision of the National HIV/AIDS strategy that was unveiled by President Obama in July. The vision of the National HIV/AIDS strategy is this: the United States will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care, free from the stigma and discrimination. As Dennis mentioned, the impact of this disease hits us close to home here in Baltimore. Inasmuch as Baltimore has the 4th highest rate of AIDS cases of any major metropolitan city in the country. We have 32.3 cases per 100,000 population here. Maryland ranks 19th among the 50 states in the District of Columbia in total population who have been diagnosed with HIV/AIDS. In 2007, Maryland was 10th in the cumulative number of AIDS cases and 2nd among U.S. states and territories in AIDS cases reported. National estimates of the CDC estimates that just in Maryland, there are as many as 9,000 Marylanders who are HIV positive and don't even know it. So my message is this: along with Dennis, along with Total Health Care, we must all become part of the National HIV/AIDS strategy by being tested, by being more informed, dispelling the myths around the disease we can contribute to the goals set out in that national strategy. So in the words of the National Black HIV Awareness Day theme, get educated, get tested, get involved, and get treated. Thank you.
Thank you, Mr. Reese. For those of you who were not listening, 9,000 Marylanders are infected with this virus and don't know it. So just think, if this was Maryland, how many people, just on this section alone, could be infected and not even know it? It's not funny. If you don't get treated, you're going to die. Those of you who have children, who's lost somebody with HIV and AIDS? I did. Have you ever seen it? Do you want that? It's not funny. If the testing is free, take advantage. People have died, not for you to laugh. Now I came here to host and I'm looking around and it's like joking. It's not funny. I'm raising a young black man. One day he's going to meet a young woman and make a decision to have sex, whether it's protected or not. This thing can get so serious, it can be airborne. Wake up, black people. I said it. Wake up. Get tested. These people are here, spending their time where they can be at home with their families. Save my son. Save your son. Save yourself. Get tested. Real talk. I'm done. Thank you. Y'all can write a letter to Radio 1 if you want to.